Hello, welcome. This is the IHE Pharmacy webinar, and today we are going to explain to you what IHE Pharmacy does and what their work profiles are. My name is Michael Tan. I'm from NICTIS, and I will do this presentation together with Esther Palin from GS1 Netherlands. So we have 5 topics to present in this webinar. First of all, we would like to tell you something about our vision, our mission, and our goals, and what our pharmacy profiles can mean for the care providers. Then, of course, the core of the session will be explaining the profiles from IHE Pharmacy, but we also do other work, which is not specifically for pharmacy, but other domains. So we will tell you something about that. And if you're interested to get in touch with us or see about our work, then we will tell you about the background and the links, which can be very useful for you. So let's go into our vision and mission. Now, a little bit of history. Actually, pharmacy is a very young group. If you compare it in the family of the IHE domains, then it is the youngest in the family of domains. So we are only have been established since 2008. Now, if you compare that with radiology, which is already 21 years old, then we are still very young. And I'm not exactly sure, but probably the reason is that before 2008, a lot of hospitals tried to find their own solutions within their walls and not look beyond the walls. And what you see in 2008, especially in Europe, that regional programs started running, trying to find standards which can be useful for regional implementation or a national implementation. Now, our work from IHE Pharmacy covers, of course, the field of the hospital. So it is from the prescription and medication order through the validation from the pharmacist, the dispense, and of course to the administration to the patient. But we also have looked beyond the hospitals. So it is also covering the community pharmacy, where it can be starting from, for example, from the medication planning to the prescription, to the, from the GP or the primary care providers to the pharmacy, and nowadays we're also looking into the home nursing and the patients. Now, what is our vision? Our intention is to support the needs of the community and hospital pharmacy to support their information flow to make it as seamlessly as possible. Now, I would also would especially focus on the domain just between the hospital and the community, because that is where in practice we see that there's a gap in the standards and in the information available. So our mission is to produce profiles and give guidance to the IT vendors, to the institutions, to produce standards and work procedures to share the information to support the prescribing and dispensing processes. Up to now, it is especially picked up in European countries. So the countries that are involved are, for example, the Netherlands, Belgium, Austria, Switzerland, Greece, France, and Portugal. And once in a while, we have somebody participating from Australia as well. And the pharmacy group is supported by the European Association of Hospital Pharmacists, NICTIS, and GS1. Now, what are our goals? Of course, the most important goals is to produce these IHE profiles and white papers, and of course that's the intention is of course to support the information exchange between the institutions and the healthcare organizations. That in turn also is intended to automate, of course, the work between these various participants. And of course, from that, we are also trying to promote our work. So, for example, this IHE webinar is an example of that, and try to find more supporters for the IHE pharmacy work. Now, let's see what our pharmacy work can do for the care providers and the institutions. What we see generally everywhere in Europe, probably as well in Asia as in the United States, is that the population is growing older. And that, as a result, is more medication is being used by this population. If we want to keep up with the level of the quality level of our healthcare, then we must do something about that. So what we see is that to keep the cost down, the institutional care is moving towards the community, including home nursing. What we also see is that patients are being more involved in the workflow, and because there are several parties involved, which go beyond the one system, is that you need a transfer of information between these systems. So e-health is going to play an important role in that. And you need to digitalize the workflow and the data capture and sharing. Another trend is that traceability becomes more important. You see, for example, projects and programs for prevention of falsification. Now, what can it mean for the care providers and the institutions? First of all, it provides the information which you need to perform your workflow of prescribing and dispensing. So it provides information, it reduces the need to call the other care providers. For example, in the Netherlands, we still use a lot of faxes and paper to support the current medication flows. But with IHE Pharmacy, we can reduce that. We can also reduce the phone calls which the pharmacists have to do now to ask why certain prescriptions have been sent or why it is changed in dosage and support. It also supports the workflow in the pharmacy, and it reduces the time to ask for authority requests and logistics. And of course, it is also less manual registration, because once you have put it into the system, you can share it, and the other persons can benefit from that work. Now, let us look into the profiles we have. Here we have a list of the profiles which you have published up to now. On the top, you see the hospital medication workflow, HMW, the community medication prescription and dispense, the CMPD. The PRE stands for the prescriptions. The PADV is the pharmaceutical advice. The DIS stands for the dispense. The PML for the medication list. And the MTP stands for the medication treatment plan. And the more recent profiles are the mobile medication administration and the uniform barcode processing. Now, we will explain to you what it all entails. And in general, you can find the background of the story in our white paper. It has been written in 2010, but it still is very useful because it describes the community pharmacy use cases and the hospital pharmacy use cases. And of course, important in IHE, you can find all the actors which are playing a role in our profiles. What you can recognize in general is that in pharmacy there are some basic steps which are coming back every time, whether it is in the hospital or in the community. So there's always some prescriber making a prescription. There's always a dispense done by a pharmacist, but in between it could be that's not always the case, but in certain countries it is a habit, a custom, is the pharmaceutical advice, where the prescription is first being validated before it is being pushed through to the pharmacist. And of course, in the end, it is the intention to administer the medication to the patient. So administration is certainly a part of standard workflow.
हाँ
And this is the hospital medication workflow, where you can see the use cases is the physician who prescribes in the ward, the pharmacist who validates the orders, of course, as I just said, it is also being dispensed and administered to the patient. If you're not using one system, like a hospital information system, then it could be, of course, different systems, for example, for the prescribing or the dispensing. And you can see that there will be transactions between these systems. So there will be transactions between the prescriber and the pharmacy systems, or from the pharmacy systems to the administration systems. This HMW makes use of version 2 messages from HL7, which is health level 7. If you look into the community, then you see one document, which is the CMPD, which is the generic document explaining all the underlying separate profiles. So in this CMPD, you'd find the explanation of how the transportation is done using XDS, ITI. It also mentions all the actors in the transactions. But the underlying workflow is separated in different sub-profiles, as you can call them. So the first one, of course, is that's the prescription. Now that is in line with an ISO technical specification 17523. That's the requirements for electronic prescriptions. The dispense is in line with the draft technical standard 19293, requirements for dispense. As I have mentioned, the pharmaceutical advice can be a step in between the prescribing and the dispense. Now what we have placed here is the validation of the prescription. So if you do medication interaction checking, this could be a profile which is useful. And it also makes use of underlying profiles like picking up the medication list of the treatment plan. So it's an intermediate step between prescribing and dispensing, and does the contraindication checking or the checking on lab results. This is where it takes place. Now, as I've also mentioned, if you want to retrieve medication list, then pharmacy medication list is the document where you find this process and the details. A special thing about this is it's making use of the on-demand document work profile of IHE. And that means that you retrieve information from various documents, CDA documents, and you generate a new document on the fly. The MTP provides the information of the active and the current and the future medication of a patient. So it is a kind of a scheduling tool to see what is in the medication treatment of a patient. Now, typically, of course, in IHE, you always have to describe the roles and the interactions. So you have the planner, medication treatment planner, you have the prescription placer, that's of course the person who places the prescription, the pharmaceutical advisor, who consults and does the checking, and finally the dispenser. Of course, in practice, it could be that certain of these roles are combined to one system or to one role. Now, behind that, there are all kinds of tools and transactions we can use to retrieve all the necessary information. Basically, there are two methods of exchanging the information. One, which is more like an order flow. So you place an order and you get the order is being picked up and performed, and you get a confirmation of that order. So this is more or less like a push mechanism. And as you see in this schedule, in the middle, you can see that there is also some safety checks on medications. So this is where the medication interaction checking is taking place, or the check on contraindications. The other method is to retrieve the information. So that's where you query information, and that you can query the registry, and you retrieve the information from the repositories. So that's more or less kind of a pull mechanism. And with these both kinds of mechanisms, you can perform your workflow and your work streams. Now let me hand it over to Esther Palin for the next work.
Good morning or good afternoon, everybody. Let's go to the next slide. So, as Michael already said, I work for GS1, and GS1 is most famous for barcoding. So I'd like to share with you some developments that we see globally. We see a lot of regulation going on, which is driving implementation of standardized barcodes. This also means that there is a growing need for IHE integration profiles, since all the information from the barcodes need to be processed. If we have a look at medical devices, here is some three regulations that have come out recently. One is in the US. It started already in 2015, saying that all implants need to have a so-called UDI, Unique Device Identifier, on the package of every implant. In Europe, we have the same, and some more regions are following. And in the Netherlands, we have a so-called National Implant Registry, which mandates that certain kind of implants must be registered by scanning the UDI. In Europe, there is also regulation for pharmaceuticals to prevent falsification, and this also came into force beginning of this year, saying that all pharmaceuticals need to carry a data matrix. This is a block code you see in the screen with a product ID in it and a serial number. So standardized barcode information, what we mean by that is that all these regulations or agreements, they agree on certain kind of information. First of all, there's the product identifier. We call it GTIN, it's GS1 language for product identifier, global trade item number. Usually there's an expiration date, a lot number, and also a serial number in some cases. And it can be either captured in a barcode or in a data matrix. So if we have a look at the Homecare situation, Michael already explained that the population is getting older, and to make care affordable, more care is given at patient's home instead of in an institution. So this also requires more digitalized processing of the administration of medicines, for example. And this is where, for example, the profile for mobile medication administration is very useful. So here you can see the workflow of a typical administration to a patient. So first the patient is identified, the product is identified by scanning the barcode on it and using the IHE profile for uniform barcode processing. It is checked with the prescription if this is the right drugs for the right patient and given by the right care provider. And also the administration can be registered. Now I'd like to take you to a patient story in the hospital. For example, a patient that gets a procedure for a hip replacement, and there is some high-risk medication used and also other medication. So in this graphic you see, for example, the artificial hip, which has a barcode. The high-risk medication that's prepared for this patient also carries a barcode. The beds even can carry a barcode, and also the patient and the staff. And all the information from these barcodes need to be registered automatically, of course, in different systems. So on the right side, you can see some examples of systems that are usually in place. So there is, of course, the electronic health record to register which hip implants the patient got, but also in the ERP and the management system, this is registered to make sure that the payment is done, and also for the inventory management. So if one certain hip is used, then a new one should be ordered by the manufacturer, for example. On the right bottom, there's also some external systems that can be used. For example, some implant registries, like the one I mentioned before, the National Implant Registry, which is mandatory to use in the Netherlands, but also a lot of professionals maintain their own registries, for example, for orthopedic implants or breast implants or any kind of implant. Then the patient goes to the ward of the hospital, and also some medication might be given. And a lot of research, for example, from the US, has shown that from all the administration errors, 50% can be prevented by using a barcode on the lowest level of the package. So what I mean with that is that there is a barcode on, for example, the pill or a vial, like you see in the picture, and the nurse can scan this before giving it to the patient, and the system checks, is this the right pharmaceutical for this particular patient. And yeah, like I said, it can prevent 50% of all the administration errors. So it doesn't take out all, but at least 50%, and this can have enormous consequences for the good for the patient. So all the information from the barcode needs to be processed in different kind of systems. And for this, we made a FIRE resource messaging. And this is an example of a demo we created with the Dutch team. And here you can see that the barcode has been scanned, and the information from it is decoded and placed in the right places in the system. Last summer, G1 Global and IHE International became their Mutable members, and I'd like to mention this because it makes it much easier to cooperate on a global level, but also on a local level. And for example, me being from the Netherlands, I can take part in, for example, IHE Pharmacy or another IHE group, and because I know that my head office is a global member, and it makes it easy for me and my colleagues around the world to cooperate with you guys, and the other way around, of course, also. So here's a bit about other developments in Europe, mainly because IHE pharmacy consists mainly of European members. So this is on a Swiss e-medication project, and the goal of the project is to increase patient safety by having a medication treatment plan. And this is part of a national vision to establish a real e-medication infrastructure. So within this initiative, there's a lot of promotion going on to integrate primary systems. And it all started in 2006. So what the group entails is that there will be a wide consultation with a lot of stakeholders in Switzerland, that the implementation of certain IHE profiles are implemented. You can read what profiles they are looking at. So it's the medication treatment plan, the prescriptions, the dispatch, the pharmaceutical advice, and the pharmacy medication list. Then we move to Austria. So also in Austria, obviously the goal is to achieve more patient safety on the side of medication. And it is a national project. In Austria there are around 8 million people, and the goal is to involve all physicians and pharmacists. So this initiative started out in 2016 and became mandatory for physicians and pharmacies in 2017. In Austria, there's the Elga infrastructure, which is an initiative taken by the authorities, and is completely based on IHE XDS. So all the IHE profiles that are used are exchanged within the Elga infrastructure. So I would like to give you also an overview of some other pharmacy domain activities we are working on. We started with looking at the clinical part of the medication circuit, but now it's time also to look at the other parts, like supply chain of medication, for example, within the care provider, but also across care providers, the management of medications, and other departments that are using medication as well, for example, radiology or surgery. So it's obvious that the processes we described must be interoperable with other departments as well to be of use to the users. So one other topic we are working on currently is the supply chain of healthcare products. And we are not looking only at pharmaceuticals, but also, for example, medical devices. So we like to have like a general supply chain process, which has different standards as well. So there's a white paper which is almost finished. We are fine-tuning it at the moment. And slowly, we also start to work on the profiles as well. And for the standards, we are looking at HL7 and also GS1. GS1 has a harmonized EDI set of messages for healthcare. So the stakeholders from the healthcare sector have been working on this a couple of years ago, and it's already published. We call it Order to Cash, so it describes all the processes from ordering a product to delivering the product and also sending the invoice for the product. So with all Michael and myself told you, maybe you are interested to know more or even get involved with our group. You're most welcome to do that. Yeah, we have a working cycle which you can see on the screen. But if you would like to participate, I would like to invite you to send us an email with your questions or requests, and we are very happy to answer them. So here's some links. You can find all the work we've been doing, for example, the profiles and also the agenda, etc., and also the email where you can reach us. So this is the end of our presentation. I don't know if we can take any questions, if there's still time for that. Yeah, but thank you very much for your attention, and hope to hear from you soon.
Thank you so much, Esther. Thank you so much, Michael.
Yes, welcome.
Do we have time for some questions, maybe?
Yeah, we have about 25 minutes.
Okay, but participants. All right. But I don't see anybody raising their voice or anything. So, if not.
Yeah, if not, we can just conclude. And
all right.
That was great.
Thank you for hosting us.
Thank you so much.
Yeah, thank you.
All right.
Take care.
Okay, bye-bye.
Bye.